Thanks for coming out this morning. During the last 3 months, a lot of focus has rightfully been placed on the need for public health, our physical well-being. We've learned terms that we probably knew of but didn't use before. Asymptomatic. We've learned to sort of self-diagnose based on how we're feeling. We've learned a lot. One of the things we probably had not spent enough time talking about, candidly, is mental health. Being cooped up in a house or an apartment or a condominium with little or no access to the outside. Parents forced into e-learning situations, and kids not having the ability to socialize like they normally do. All that takes a toll on our collective mental health, and that's what we're here today to discuss. Several times over the last several months, I've encouraged people to reach out to people who may have a propensity for depression or anxiety. Reach out to them and offer a helping hand. Offer a kind word. That one phone call, that one outreach may be what they need to get them through the day or through the week. We're going to talk about that more in depth today. We've got a team of phenomenal experts. We're really blessed in Evansville and Southwest Indiana to have really great resource of mental health professionals. Emily Reedford's going to step up next with Mental Health America. Emily?
Hello, I just want to talk a little bit about some initiatives that we have at Mental Health America to help everyone, to help the entire community on this reopen phase that we're in right now, and how to help assist your employers, your employees, your colleagues, your friends with their mental health. Self-care is so important, and taking care of yourself and checking in with yourself to see where you are is critically important for mental health. And also checking on your friends who, as Mayor mentioned, may have a propensity to struggle, who may be struggling, but also check on those who seem to be doing well too. Because with everything changing, even those people who've never struggled with a mental health situation before now may be struggling. There's so much uncertainty with the financial landscape, with the schools, with people's jobs, and now a new home life in a lot of cases. There is a great impact on someone's mental health, and we have resources right here in Evansville to be able to help people deal with that. We've got several of our resources here today, and they're going to talk about what they offer. But even at Mental Health America, understanding what resources are available in our community and talking about those with people who you may be concerned with will go a long way to help people stay mentally healthy and weather this storm. Also on the Mental Health America website, you can access a mental health screening tool, and over 1 million screenings have been taken since the onset of the COVID-19 crisis, and which is phenomenal because that gives people a baseline kind of to check in with themselves, understand a little bit about what's happening, and it also provides us a springboard with how do you talk to your provider? What kind of information do they need to understand about what's going on with your situation? So check out those screenings, take one yourself. There's all kinds of different mental health screenings. There's even one for youth on there as well. So if you're concerned about a youth, definitely reach out to them too, because they're going through their own unique struggles. But the screenings are a great way to kind of, yes, self-assess, but also have something to take to your provider to say, I'm struggling with this, and here's how I know it. At Mental Health America, we can help people navigate resources. Professionals can call us if they're working with clients and they may not know what resources are available. But we've had a lot of people from the general community reach out and say, I need help dealing with this issue, or I'm struggling in this area. And we can help put them in touch with mental health providers who are doing telehealth and who are doing virtual support groups and virtual peer-to-peer support systems in our area. So please don't hesitate to reach out, because we've got a lot of resources and providers right here who are ready to help people get mentally healthy. Next we have Janie Chapel. She is with Deaconess Crosspoint, and she is the, oh my gosh, I'm gonna mess this up, the manager of community services for Deaconess Crosspoint. Janie?
Hello, everybody. Just want to echo some of what has already been said, but I am going to throw out a couple of statistics that you may find alarming. We've talked a lot about the physical health of people and the people who have died and are projected to die. It's been projected that another 75 to 100,000 people will die from deaths of despair. That includes suicide, drug and alcohol use, and that sort of thing. And that's the thing that we want to try to avoid. That's the projection nationally, and we'll also have some of the same issues locally, and we are already seeing that somewhat. At Deaconess Crosspoint, we offer inpatient and outpatient care. 24 hours a day, people can come in for an assessment, either at Crosspoint or sometimes it may need to be through the emergency room. And that's one of the things that we're seeing as well, is that people are afraid, if you will, to come in because they're afraid they might contract the virus. But we are all doing lots of screening, trying to prevent people from being exposed, and would encourage people, if they have an emergent crisis with their mental health, to come see us. We also have an employee assistance program, which is an important part of the workplace for many places, and that's where people can come in at no cost for individual therapy to help deal with the stress or depression or anxiety or whatever they might be experiencing. There is still a lot of stigma around mental health, so that's something we constantly fight to overcome, and that is still no different. Plus, throwing in the fact that people are afraid to come into the emergency room, we're trying to do a lot of outreach to people to let them know that we're available and to please contact us. I think that's all I have to say. I'm going to turn it over to Katie Adams, who is with the CEO of Southwestern Behavioral Healthcare. Katie?
Thank you, Janie. So one thing that I'm thinking about today is workplace stress. A number of us have been working from home, and some of us have just started to get back into the workplace, maybe even part-time. And recent studies have shown that over 80% of people in the workplace are experiencing some pretty significant stress. And that stress manifests itself in ways like you're not sleeping well, you're not concentrating well, you're more irritable, or you lose your temper easily. And so one thing I want to bring up is that as we go back into our offices and back to our workplace, we're different. And I think that we need to choose kindness with one another. We need to encourage self-care and develop this workplace kind of atmosphere of mental health care. That mental health days are good things. Mental health days are things that I announce to my staff. I'm taking a mental health day. That this is just part of our culture. We are all going through an enormous amount of stress. It's unprecedented and it's really uncertain. We don't know when this stress will end. If we knew it was going to end July 1st, we could handle this in a different way, but we don't know when it would end. So this stress that we're all experiencing, I just want to encourage our employers to be sensitive to these things, to consider employee assistance programs if you don't already have that as a benefit. Deaconess mentioned that they have a program. Southwestern Behavioral Healthcare also has a EAP program, and there's others in the community. And it really is an inexpensive benefit to provide your employees some free help, and that free help is easier to access through a benefit like that through your employer. So just encouraging workplaces to be sensitive to these issues, because we are different than we were a few months ago when we were working in the office together. And lastly, for all of us, just encouraging and echoing what Emily and Janie said, is that mental health care is so important. We often push it off and ignore it, but it just compounds itself to it comes to a place of no return. So please know that mental health care has not changed in Evansville. Deaconess and Southwestern are the largest mental health providers here in our area, and we haven't changed. We're still here. We are offering on-site, face-to-face services, but also telehealth. So if you're not comfortable coming in, we can do everything through phone call or audio-visual sessions. but also we have services on site with the appropriate screening and social distancing as well. So reach out to one another, encourage people to get the help that they need during this time. Thank you.
Any of these experts would be happy to take questions from you.
Just throw it out and somebody will, yeah.
We touched on youth mental illness. I know, I'm sorry. Okay. We touched on how important it is for kids to reach out, parents, kids. Can we talk a little bit about what is available for youth? Age range, or what is available for mental health when it comes to youth?
So treatment for youth, if you think about our kids right now, I'm actually very concerned about our families that are in high-risk groups. Our services through Southwestern are continuing for youth. It's just largely through telehealth. We are starting to provide more in-home services for families that are really struggling. As you can imagine, parents who are managing special needs children are under unprecedented amount of stress that it's hard to imagine. And so there is support for parents during this time, as well as for youth. And so the services that you would normally get pre-COVID are still happening. And so I would just encourage folks to reach out for that help. Southwestern Behavioral Health Care provides mental health and addiction services for the entire spectrum of ages. So it could be a toddler, or it could be, a 16-year-old. So I'm glad that you brought that up, because right now families are enduring an extreme amount of stress managing this with school and limited child care options.
Can I add something?
Sure.
At Deaconess Cross Point, we are also continuing to see children. We have an inpatient unit for youth. We are admitting people to those units if they need to be. It's a crisis stabilization unit. But we also have therapists and psychiatrists who see the whole spectrum of ages as well.
Katie touched on Yeah. So I know that the state relaxed some guidelines. So what does that look like right now?
So the state and actually the federal government has relaxed a number of guidelines with telehealth, and one of that is where the client can be during telehealth. It used to be that the client would have to be in a office, seeing a provider that could be home or in an office. And so one thing that was relaxed is now a client can be at home. So that has been wonderful, because transportation is often an issue, as well as the concern about social distancing. The other relaxed guideline was HIPAA compliant platforms. And so the Zooms and the Facebooks and all of those kinds of chatting kind of features are now open game for anybody to use. Of course, that will go away at some point. So Southwestern's chosen to use HIPAA compliant versions just because we know we want to continue this. So those, and also most insurances now are acknowledging the codes for billing telehealth. So there's no restrictions in how we're billing. The other thing is telephone is also a billable service now as well. So some of our physicians that need to have contact with our clients that don't have smartphones, they don't have maybe the cognitive ability to manage the internet, or they don't have internet, or their internet is limited, we can do phone calls. And so phone call is a billable service now as well.
Has there been any research on the local level about the mental health issues that are really harming our tri-state area, or in Evansville, Vanderbilt County?
Well, I'm going to let Janie speak to the suicide issue that we're experiencing. She has some statistics about that.
That being said, would you repeat the question? Would you repeat the question for me? I'm sorry.
Has there been any research done at the local level? I know you talked about nationally we're seeing increases, but is there one mental health issue that's really harming our local area more so than maybe nationally?
I don't think there is any one issue. Suicide and mental health issues are related to a lot of different things. It's really hard to pinpoint one thing that might cause someone to decide to attempt to take their life or to continue to start drinking more.
But some of the risk factors that are already there are worse now everywhere, including here, and that would include job loss, or at least not being able to go to your job, a lack of social support, being confined. A lot of people, if they are confined to their home and are used to, say, exercising to help deal with their anxiety, the gyms have been closed. So a lot of that will help as things open up. But I think the thing that we need to remember too is that just because things are opening up, there's still a trauma that's associated with all that's happened that can come at different times and cause the person to be more anxious even though things have lightened up a little. So I think in terms of research, we work really closely with the coroner to look at suicide deaths and reasons, although I do want to be real clear that reasons are hard to point out because it's such a murky ball, if you will. But we have seen that in our area, yes.
Have you seen anything that indicates there's been a spike in the last 3 months between suicide and change?
We have a team of people who reach out to those who have lost loved ones to suicide. It's called the Hope Team, and we have noticed an uptick in those calls. I think you would probably need to speak with the coroner to get those exact numbers. But I know that we have seen an increase in those calls. I'd like to say something else that's not related to that. Is that okay?
Go ahead.
Okay. I also wanted to, in addition to the telehealth that we're all doing, and the Zoom meetings and the Zoom groups, our 12-step groups are also really active with the Zoom meetings, which is really important because, again, of that isolation with somebody who's struggling with alcohol or other drugs. So I just wanted to throw that out there that in case anybody is struggling with that, those groups are still meeting and they can contact any of us to figure out how to get onto that. So I just wanted to point that